Numbness, tingling, and loss of sensation around an incision site after a surgery is not only common, it is expected. My name is Kelly. I am a physical therapist and I specialize in cancer rehab as well as lymphedema and lymphatic health. Today in this video, I'm going to talk about what causes the numbness after surgery, such as a mastectomy surgery or plastic surgery like liposuction. How long does this numbness and tingling last, and what someone can do to help get their sensation back. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram and check out our website for more resources. So first, what causes numbness and tingling after surgery? The leading cause of numbness, tingling, loss of sensation, or change in sensation from surgery is due to the nerves and the nerve endings being affected during the surgery. When a surgeon creates an incision in the skin, this is going to damage or cut the nerves. You have about 7 trillion nerves in the body, and nerves do different things. Some nerves have a role that they feel or sense hot or heat. Some nerves sense cold. Some nerves, their role is to feel sharp pain or sharp sensation, and other nerves feel light touch. They all have a different role. And so because of the sheer number of nerves and nerve endings in the body, it is impossible to avoid cutting or damaging them during surgeries when an incision is made. Now, if someone has a more complex surgery, such as like a mastectomy where a lot of breast tissue is taken, or someone has a liposuction that there is a lot of tissue removed from the abdomen, there are going to be more nerves affected because of that, so that individual may have more numbness than someone who has a small incision. So when these nerves are cut or damaged or moved around during surgeries, that's going to cause the numbness, which for some may last for a couple days, but for others it can last weeks or long term, or it could be lifelong. There are other individuals who feel tingling after surgery, and that could be that the nerves are trying to regenerate after surgery, which can cause more pins and needles. Sometimes that will subside pretty quickly, and again, sometimes it takes a little bit longer. So how long does this numbness and tingling last? Now, this can vary widely. It depends on the person. It depends on what kind of surgery someone had, what part of the body was affected, and then how complex the surgery was. If someone had a minimally invasive surgery with a really small 1-inch incision and it was just localized to that area, they might just have a little bit of numbness and tingling for a short time. And if it lingers long term, it may be just that little area that they have a bit of numbness. If someone, like we talked about before, has a more complex surgery, such as that mastectomy where a lot of breast tissue is taken, or a liposuction where they have a lot of abdominal tissue taken, that may linger on longer because there are more nerves embedded around all of that tissue. And so individuals may have numbness in the area for a short time, and then some individuals never get full sensation back. If someone has multiple surgeries, such as they had the mastectomy and then they had reconstruction later, or maybe fat grafting later, or multiple surgeries like that, they are at even higher risk for having the numbness and tingling that can be more permanent. Now, yes, nerves can change and regenerate over time. A good rule of thumb that a lot of surgeons will use, that if the numbness is still there after about a year since the surgery was completed, then it is more doubtful that full sensation will return. So what are some ways that someone can help improve sensation and numbness and help calm down tingling? Unfortunately for many, we don't know how much is going to return and how quickly it will return. But if someone is cleared by their surgeon for safety reasons, an individual can start what we call desensitization. This is where we take light touch with our fingers, or we take different tactile textures such as a soft Kleenex or a washcloth, and gently massage over the area, which can help stimulate and signal the nerves for regeneration. This should always be done with a very clean, well-washed hand to avoid bacteria to the area. You definitely want to make sure that the incision is fully closed and you are cleared by the doctor to do so, and it should be nice and light. So what we do, if the incision area, is a small area here, we take our hand and lightly just massage in any direction over the area for about 2 to 5 minutes. And that can be done throughout the day 3 to 5 times. Someone can then build up to different textures, such as the Kleenex, or something just mildly rougher like a washcloth. But we want to make sure that we avoid things like Velcro or any other rough surfaces that might scratch or damage the skin. And like we talked about, there are different roles for different nerve endings and nerves. And so those are techniques for the nerves that are affected by light touch, which usually cause more numbness. Now, some nerves that sense hot or cold are also affected. So what we do is use light variation in temperature to apply to the area to help with that as well. And so if someone's affected with cold, we can take a washcloth and make it cool, not ice cold, but cooler, and then also apply that to get that sensation working and stimulated as well. You want to make sure for safety that you really truly know what the temperature is of whatever you're using. So if you're using something that's warm or hot, you want to make sure that you know exactly how hot that is, because your sensation and your nerves are not going to know exactly. We do not want to cause any damage to the skin by burning it or having it too cold, because that can make the nerves even worse and the sensation even worse. If someone has more tingling, like that pins and needles feel, that can be a lot more uncomfortable than anything. But desensitization with gentle touch and light touch can help stimulate and regenerate that and help calm down those nerves. Some doctors may also prescribe some sort of topical cream or lidocaine-like cream to the area to help calm down the nerves as well. Along with that pins and needles, I see a lot of individuals who also have what we call hypersensitivity, where they are very hypersensitive to any sort of touch. So they don't even like clothes touching that area because it's just so sensitive, and that can be painful. So what do we do for that? Same thing. We do some sort of gentle, light desensitization that we start really gentle and light to what someone can tolerate for 2 to 5 minutes, and then gradually build up to different kinds of fabrics as someone can tolerate that. It can take some time, but the worst thing someone could do is not touch it at all, because that doesn't help the nerves regenerate or stimulate and rewire. Overall, as you can see, the best thing to do for numbness and tingling and loss of sensation after surgery is something like desensitization or working with your doctor for more personalized guidance. Overall, nerves can vary from how long they regenerate and who does get sensation back and who does not. The best thing you can do is to keep working through it, but know that some of that numbness and tingling may be permanent. Now, I hope you all found that information helpful. Again, work with your doctor for more personalized guidance, and we'll see you all next week in another video. Thanks, everyone.